hand hygiene training session was conceived to strengthen infection prevention and control practices in our public health centers.
Why do we need to strengthen hand hygiene practices? The hand, like we thought, is the most common way through which germs spread. So teaching and strengthening that practice is very important. Letting the healthcare workers know that hand hygiene is important with the use of soap and water, as well as with the use of the hand sanitizers.
We believe that these primary healthcare centers are like the first resort for community members, for people in the community to seek basic healthcare. And these people, when they come here, these facilities are also vulnerable to healthcare-associated infections and even disease transmission generally. So it is important that these healthcare workers working in these primary healthcare facilities, they have improved knowledge of effective hand hygiene practices and all other basic IPC practices as well, so that they are able to properly protect themselves and their patients and keep the facility environment safe, essentially.
What we hope to achieve by this very short hand hygiene training program in our primary health centers is that we're able to raise IPC champions. I mean, hand hygiene ambassadors, people who are, leading the implementation of hand hygiene, people who are not just observing, appropriate hand hygiene practices because they have learned this lesson, people that are providing that leadership, people that are holding others, their colleagues accountable to compliance with hand hygiene. We hope to see an increase in hand hygiene compliance across our primary healthcare centers.
This knowledge is going to improve my work by expressing it out to other people, to my colleagues, even at home, to my family, my immediate family, or to relatives generally, to let them know how important it is for the hand washing.
I personally will be a front runner of hand washing, especially educating patients on it, demonstrating each of the 5 steps to ensure that even after they leave the premises, even at our home, wherever they find themselves, they ensure adequate hand hygiene practices wherever they are.
As from today, I promise, whenever I'm in the midst of mothers giving my health education, I will always let them know the importance of hand washing, especially to the mothers, breastfeeding mothers, pregnant mothers, that they need to be washing their hands time to time in order to prevent infection.
So our choice of these local governments, Ikorodu, Ibejuleki, and also Badagry, is because there is disparity in terms of presence of government health facility infrastructures, and also in terms of development partners support to our health facilities.
Most of the things that work well in IPC is availability of running water. Despite the poor power supply, we make sure the water is running. Even sometimes we might need to pump water with generator, but we make sure there is running water to be able to wash our hands. Then availability of liquid soap to be able to wash our hands. Also availability of safety boxes and prompt disposal to the appropriate quarters by the normal personnel.
I learned a lot on hand hygiene and IPC measures, but significantly learning the 5 steps in hand washing and its significance.
The 5 moments of hand washing within the healthcare environment before attending to a patient, and then before you perform any aseptic procedure, after exposure to body fluids. Number 4 is after touching the patient. So after you touch anything within the patient's surrounding, you need to wash your hands. They need to understand those moments that they need to practice hand washing to prevent the introduction of infection to the patients. And they also need to understand those moments they need to observe hand hygiene to prevent themselves from contracting infection.
Nǹkan tí mo kọ́ lè ní pọ̀, ẹ̀kọ́ tó dára fún ìmọ́tótó, a máa ṣe ìmọ́tótó ilé, a ṣe ìmọ́tótó ibi iṣẹ́ wa. Ní àkọ́kọ́ bẹ̀rẹ̀, èyí tí mo kọ́, ẹ̀kọ́ tí mo kọ́ tí mo rí pé ó dára jù ni pé kí a tó ṣe ohunkóhun kí a máa fọ ọwọ́ wa. Ọwọ́ wa fífọ̀ ló ṣe pàtàkì jù.
Step number 1, before you even put soap, you wet your hand with water. Step number 2 is to apply soap. Step number 3 is to wash all the 6 important areas of the hand. The 6 most important areas are palm to palm, back of the hand, in between your fingers, your fingertips, then your thumbs, that's number 5, and then your knuckles. Step number 4 is for me to now rinse my hands. And then step number 5, I have a tissue. I'll use the tissue to dry my hands. We want them to understand the 5 steps of hand washing according to the guidelines provided by the World Health Organization. A lot of people, health workers, understand the fact that they need to wash their hands, and they do actually practice this, but the correct steps, we find out that many people do not know it, so they need to also understand those 5 steps of hand washing.
Most times in the hospital setting, we have this spread of infections. Patients come to the hospital with a particular ailment and they end up going back with a different ailment. But by this training now, we know how to interrupt the spread of infections.
With this training, I learned that I must wash my hand first before wearing my glove to attend to patients.
So when you want to put on the glove, the first thing we do is to wash our hands before we wear the glove. So the importance of the use of glove is basically to protect the patient, protect the healthcare workers, and ensure that there is no form of germs transferring between the patient and the healthcare worker.
It's not that because I'm a health worker that my hand did not contact any infection. It will reduce spreading of infection to my patients. Yes, it will avoid it. And after attending to patients, that if I wash my hand again, it will even avoid or reduce contacting infection from my patients.
As a lab technician, I learned how to segregate our waste using of red, then using of the red nylon, using of the yellow nylon, and using of the sharps and the black nylon.
We are seeing different colors right here, right? We have the red, the yellow, and the black. Anatomical or the highly infectious is the red bin liner. So we have body parts, tissue samples, organs, blood. But in the yellow liner, what we have is the dressings, the soiled gloves, the swabs, the bandages, and our aprons. Then the domestic, as I said, food, glass, plastic, and all sorts. So this is what it looks like. This is the yellow, this is the red, and this is the black like we have here. And these are the boxes that, we put those liners in, right?
When we say health workers, we're not looking at those that perform clinical procedures alone, the nurses, the doctors, but we're looking at everybody that operates within the healthcare environment. So it's important for them, for instance, to understand how to properly segregate the waste generated within the healthcare environment. It's important that they also know how to manage their waste from the point of generation to the point of final disposal of the waste.